Well, today our topic is what are the symptoms of fibroid? So what are the symptoms of fibroids? Good question, right? So do you know any symptoms that can cause, apart from like bleeding, right? Menstruation and non-stop bleeding, apart from that, are there any other symptoms that you may get if you suffer from fibroids, right? What are the symptoms of fibroids? Do you know about this? And can you name some of them? Yeah. So the question is, can you name some of them? If you can, please type it in. Please type it in and let me know what sort of other symptom that you think may get if people suffer from fibroids, right? So I'm going to my Instagram. Yeah, if you're on Instagram, please give me a thumbs up and share this live video. If you're on Facebook as well, please thumbs up, share the live video. YouTube, give you a thumbs up and say hello to me, and all other platforms, please say hello to me. Okay, thank you. Okay, now the question is, apart from bleeding that's causing the symptom, right? We all know, most people know, wow, if you have non-stop bleeding, you may get fibroid. It may be due to fibroids, right? Now, what are the symptoms that you may get? If you know any of them, just type it in, please. Hi, HI 1983. Thank you for giving a thumbs up. Thank you very much. And please share on your social media if you could do that for me. Thank you. Yeah. So our topic today is the what are the symptoms of fibroids? What are the symptoms of fibroids? Hi, Eric. How are you? Yeah. Hi, Beru. Right? You know. Upload some cosmetic acupuncture video step to step. All video very knowledgeable. Thank you very much. Thank you for supporting. Yeah, for the cosmetic acupuncture one, I haven't actually learned it, to be honest. I have few patients that's waiting for me to learn it and do some amazing work for them. Because due to the COVID-19 lockdown, so I was going back to Malaysia. I'm from Malaysia and live in New Zealand and practice in New Zealand. And I was going back to Malaysia and learn that technique in May. But of course, we locked down and we couldn't do that. And then it has been extended. I was going to invite Master Tree to New Zealand and to teach us the cosmetic acupuncture as well. But unfortunately, won't be this year. And we're looking for next year teaching English. So they extend the workshop from May to September, and there are two will be in September. One September, the other one is November in Malaysia. But we're not sure yet if whether Master should be able to travel from China to Malaysia, right? We may need to extend postpone the date again, So this is what it is, and we all suffer from COVID-19, and I'm here that to ask everyone to pray for COVID-19, pray for people that who are suffering from COVID-19 will be strong and positive and go through this COVID-19 lockdown. All right, let's start. What are the symptoms of fibroid? Be in mind, Hi, happy day. How are you? Now, your symptoms, fibroid symptoms, will depend on the numbers of tumors that you have, as well as the location and size, how big they are, where they actually grow in your uterus, and how big is the size. You know, and for instance, okay, uh, submucosal fibroids may cause heavy menstrual bleeding and trouble conceiving, cause fertility and heavy period. But all this thing, all this, uh, we just mentioned that it may cause, it may not at all. It may not at all, okay? If your tumor is very, very small, or you going through menopause, or while menopause is coming out, or while you're on menopause, or after menopause, okay, you may not have any symptoms at all. No, well, why is that? Why is that? Because fibroid is dependent on estrogen and progesterone to grow. So those two hormone stimulate the fibroid, the cell, to grow bigger. Happy days. Can you come to have a workshop in Nigeria? Yes, I will be happy to. Can you organize it? You can organize it. If you can get people together, then I'll be happy to travel to go there. But of course, not in this year. Maybe we'll look at for 2021 or 2022 after COVID-19. Okay. Yeah, sure. You can organize it. Yep. I'll be happy to travel. No problem at all. We can talk on WhatsApp, okay, or on Facebook message, private message, right? Thank you for the offer, and that's great that you mentioned about that. And yeah, I'm happy to go any way that I could to share with you guys and to teach my knowledge, acupuncture skill, and things like that. Okay. Okay. Now, fibroid may shrink during or after menopause. That's because when you have fibroid, we know that progesterone and estrogen that is causing it, and that will make it worse. Okay, and when it comes to menopause, which means the production of the female hormone estrogen and progesterone decrease. When they are decreasing, which means the fibroid has nothing to support them to grow, right? And they shrink, or they stop growing, right? It becomes small and small and small and small, and they maybe disappear. Does that make sense? Okay, does it make sense to you? So, hi, good morning, Veronica. Thank you for saying hello. All right. Okay, now let's keep going. So what are the symptoms apart from heavy menstrual bleeding? Right. The heavy menstrual bleeding, it can be during your period, when you have your period. If your period is 28 days, right? And 5 days, it's the cycle is 28 days, and 5 days of bleeding. Right? You get large amount of bleeding, heavy, right? Or you get it in between your period, right? You have one period and you expect another 28 days to get a period, but you have it in the mid cycle. or you just period stop for a few days, it came again, and it's quite heavy. And that may include that blood clots in it. Okay. What diet can you suggest for fibroid? We'll talk about it when it comes to diet, but I always suggest vegan diet, vegan plant-based diet, plant-based diet. Okay, plant-based diet for everything. That's the diet that you should go for any kind of disease, and the human to maintain good health and well-being. The plant-based diet is what I suggest for all my patients. Okay, and no dairy, right? No dairy is important. Okay, pain in pelvis and lower back. So yeah, if you suffer from fibroid, you may get pain. You may get pain. And let's talk about pain. The pain, when do you get the pain? The pain can be any time in the month, any it doesn't really come with just period when you're bleeding. It may more likely in when you have menstruation, while menstruation, but it can cause pain anytime, right? And any date in the cycle, in any period in the cycle. Okay, and where is the pain will be? The pain will be in lower. It can be in the pelvis, can be in the groin, can be in the lower back, lower abdominal. Is it about lower back and over here, 八髎 sacrum area. It can be from here. It can be in here. Okay, it can be in here. What else? Pain. You may suffer pain during intercourse. Now let's think about what can cause pain. What, you know, when you say, well, women who suffer pain while intercourse, it can be fibroids, it can be endometriosis, it can be inflammation pelvics, right? So you know that you can't just say, oh, if you suffer pain from it while intercourse, is that is definitely fibroids. No, it's not. Or definitely endometriosis. No, we don't know. Okay, but we know pain while intercourse is abnormal, and that means something's happening. Okay, it just gives you a sign something's happening. Then you need to be smart and to figure out what is actually happening, right? Okay. Then if the fibroids grow, what would happen? It will compress the organs around it. What organs would it compress? Well, it may compress the give pressure for the bladder. Then that increase your urination. You go for urine more often because there's not enough space for urine to contain the water, right? To hold the water. So you go to the toilet a lot, easily. Okay, that is, it may increase urination. What else? It is quite big. It may cause constipation as well, because it compares on the bowel, intestine. So it may cause constipation. What else? Do you know what else? Do you have any idea? What else would you think of? Monica, don't worry. It's not a class that you have to be on time in here, but I appreciate that you every morning that in my time that you actually came here and say hello and join us for for this live video, and thank you for your supporting. Yeah, it means a lot to me. Thank you, and happy day, and Eric as well. Thank you very much. Yep, small intestine. Okay. Yep. So what? Yeah, and when compared to small intestine, it may cause constipation. Right? It may cause constipation. And what else? So when it causes constipation, it may cause pain, right? Bloating. Yes, it may. It may. Okay. Now, the menstruation, normally we talk about heavy, right? Heavy menstruation, heavy bleeding. But when we talk about menstruation, bleeding, it may last for longer. And normally it's about 5 days. It can be up to 14 days, and even longer. A patient keep bleeding for about 3 months. 3 months. And I have another one bleeding for about 6 months. 6 months. Right? And I'll tell you, all the ultrasound, when they say they can't see anything, it may not be really nothing in it. Because this patient, for 6 months, she had another skin and actually have a small fibroids in there, very small one, and I miss it, and then miss it, and that small one, it's just one, and actually caused bleeding for 6 months. And then the second ultrasound, and then they decided to just remove the fibroid, and ever since they removed, period back to normal. That's what it is. So if you're asking me when to get surgery, you know, and it seems a little one, it's just one in the first ultrasound scan and they miss it. But when it comes to second, the first one they miss it. The second time they actually found it, and not until it's after 6 months. Bleeding for 6 months, they couldn't find any reason for it. And after 6 months, they found it, and they remove it, and what happened? Bleeding stopped. And it's a small one. So when it comes to fibroid, it really depends on where the fibroid is. Because fibroids, a little one, it may cause bleeding. A big one, it may not cause bleeding or pain at all. And it's very difficult to see. Right? Yeah, the only to diagnose properly, you have to we actually rely on ultrasound. But ultrasound sometimes will and not picking up exactly what's going on. Yeah. So it's a mess in here, to be honest. In the but most of the time they can pick it up, no problem at all. Yeah. Okay. Now you may feel bloating, fullness, pressure on the lower abdominal, right? It's getting bigger, and you may feel like you may see that while it actually can see it, your tummy swelling, you know, like one side bigger than the other side. Here may bigger than the other side, because if the fibroids growth in here, or you may feel, wow, this person like they're pregnant, bigger for three months pregnant, because the fibroids that make the increase, enlarge the uterus. Okay, so make the tummy bigger. Okay, now tomorrow we're going to talk about how are fibroids diagnosed. How do you actually diagnose fibroid? What we just mentioned, all the symptoms: heavy period, period longer than usual, you have blood clots and pain in the lower back and pelvic area, lower abdominal, bloating, and pain while intercourse, your urination increase more often, or constipation, you know, and all this fullness and bloating, and you may increase the cramp in your period too. All this thing, you can't collect all this information and just say, "Wow, you have fibroids." No, because heavy period, you can get heavy period without fibroid. Pain in pelvic, lower back, and abdominal, you can get pain in pelvic and lower back without fibroid. You can go for urine a lot without fibroid, right? All the symptoms, you get fullness, pain, and period longer, or period quite heavy, and you can't stop a period. You can get a functional dysfunction of the uterine, then it causes the bleeding, menstruation longer than usual, or the hormone problem. Okay, it could be anything. So you can't just tell, oh, you have heavy period and your period can't stop, and that is fibroid. Now you need to get to tomorrow we're going to talk about the diagnose. How do you diagnose it? Okay, apart from the symptom the patient tell you, but you have to combine all the symptoms, ask the patient a lot of questions, and you figure out, oh, that pain, they have longer period, heavy period, yeah, intercourse, and often urine, and maybe sometimes they get constipation. Then you have an idea, okay, and maybe fibroid. But how do you be sure? If you send it for ultrasound, if ultrasound pick up this fibroid, then definitely fibroid. We know that all the symptoms may cause for the fibroid. Does it make sense to you? So tomorrow we're going to talk about how our fibroid is diagnosed. Tomorrow morning we're going to talk about how our fibroid is diagnosed. Okay, I hope this all makes sense to you. Okay. I hope this all makes sense to you. Right. The symptom in fibroids is not, you can't just say, well, it's just one, and every one symptom, and then you can tell or that you can be sure that is fibroids. Okay, no, you can't. Okay, you can't. And just happy day. Do you have any question? Any more questions? We'll talk about diet differently. Okay. We definitely want to talk about it. Let's see. Do you guys have any question? Oh, yep. Veronica have one question. Is polyps similar to small fibroid? Now, it's two different idea though. It's two different idea. Polyps is polyps. Fibroid is fibroids. Okay, they're very similar. They're very similar, but they're actually different. They're actually different. And the skin, is quite similar in the skin, because the shaver can be similar, and it also can for polyps it can cause heavy period and stomach pain, so it seems like quite similar, and the skin is quite similar when you look at it, and when symptoms, some of them are quite similar. Yeah, it's very easy to get into, while the polyps diagnosed as fibroids. It could, right? How many times can one use moxa in a week? Every day. Twice a day, 3 times a day, it's fine. Yeah, every day. No problem at all. Right. That's it for today. Okay, I hope you all enjoy it. I hope that makes sense to you about the fibroids. And tomorrow topic, we're going to talk about how are fibroids diagnosed. Thank you very much. See you tomorrow. Let me stop this.